Hey guys, this is Dr. Hub. Today we'll look at the incidence and the prevalence. So there's incidence as well as the prevalence. So to begin with, the incidence in the epidemiology. Incidence in case of the epidemiology. So the incidence is the number of new cases occurring in a defined population. So it's the number of new cases which appear in a defined population, new cases in a defined population, and this is during a period of time, and this is during there is a period of time, and the incidence rate is expressed in percent time units. It's expressed in the percent time units. So usually it is per 1,000 per year. It is usually 1,000. It is usually 1,000 per year, and it is given by the following formula. So there is a formula to understand that. So it means that the incidence is equal to, there is the number of new cases of a disease. So number of new cases of a disease, and this is in a specific period of time, so this is divided by the population at risk during that time. So population at risk during that time, so this is into 1,000. So it is the number of new cases of a disease in a specific period of time divided by the population at risk during that time. So it is generally used for acute illness. So it is used for the acute illness, and it provides an insight for the effectiveness of the health services and program. So it ensures the effectiveness of the health services and the programs. So the incidence can be determined from the cohort studies and the longitudinal studies. So the incidence, it is determined with the help of the cohort. So there are something known as the cohort studies as well as the longitudinal studies which help. So the incidence rates of spells of sickness is equal to, so let's look at the formula. The incidence rate of spells of sickness, So what is this equal to? So this is equal to the number of spells of sickness starting in the specific period. So it is a number of spells of sickness starting in the particular period. So it starts in a specific period, and this will be divided by the mean number of people exposed to that risk. So the mean number of people exposed to that risk, in the specified time. So the entire thing is multiplied by 1,000. So this is the incidence rate of spells of sickness. Next we'll move on to the special types of incidence rates. So under the special types, it includes, there is something known as the attack rate. And so it is used when there is a risk for a limited period of time. So basically in attack rate, there is a risk for limited period of time. Next is, we move on to the secondary attack rate. So in the secondary attack rate, there will be, it is the number of exposed persons developing the disease. So it's number of exposed persons, so who develop the disease, diseases, and within the range of incubation period. So it is within range of the incubation period, following the exposure to primary cases. Following exposure to the primary cases. Next is we move on to the prevalence in case of epidemiology. So let's look at prevalence. So prevalence is a proportion of all cases. So it is a proportion of all cases and given the new, old of a particular, the old and the new of a particular disease at given point in time. So it includes the old as well as the new, and this will be at a given point of time. So a given point, this is in a given point of time, and it is also over a period of time. So it is over a period of time, and it is given in a population, in a given population, in given population. So it is a proportion, not a rate or ratio. So it is a proportion, strictly a proportion. Next is the prevalence is always, it is expressed in percentages. It is expressed in percentages. So what is the formula of the prevalence? The formula of prevalence is nothing but there is a number of cases of a specified disease at a given point of time. So number of all cases, this is of a specified disease in given time, in given time, given point of time, and divided by the estimated population at that same point of time. So given by the estimated population in the same time. So this is multiplied into 100. So this is useful to determine the magnitude. So you determine the magnitude of the health problems, and it can be determined from the cross-sectional studies. So it is determined using the cross-sectional studies. Next is we look at the types. So what happens to the types? So in terms of types, there is a point prevalence. There is point prevalence, and it is a prevalence at a point in time. So it is a prevalence in a, as the name suggests, point in time. It is usually the prevalence is point prevalence unless other specified. So it's usually the prevalence is, it is point prevalence, otherwise if not, unless otherwise specified. So next one will be the period prevalence. So mainly it is the point prevalence. Now we look at the period prevalence. So this is a prevalence over a period of time. So it is a prevalence over the period of time. Next is we are looking at the relation between the incidence and the prevalence. So let's look at the relation between the incidence as well as the prevalence. So here the prevalence, it depends on the incidence and duration. So let's look. The prevalence, it depends on the incidence and the duration. Next is we look at the prevalence. It is equal to the incidence into the mean duration, So longer the duration of the disease, the greater is the prevalence. So longer the duration of the disease, greater is the prevalence. So you have a greater prevalence. So let's look at a few examples. So in terms of acute diseases, so in acute diseases, because of rapid recovery and death prevalence, so because of the rapid recovery, so in acute cases there can be rapid recovery, or the death prevalence will be relatively lower than the incidence. So the death prevalence, this will be lesser than that of the incidence. This is because in some diseases, so in case of some diseases such as the food poisoning, so what we are seeing is the disease is short-lived, so there are no old cases. So since it is short-lived, there are no old cases. There are no old cases. Next is we move on to the chronic disease like TB. So what is happening in chronic diseases like TB? So we look at chronic diseases, and this is chronic diseases like the TB, and here the prevalence will be higher than the incidence. Prevalence will be higher than that of the incidence. So in a new treatment for a disease is effective. So if a new treatment for a disease is effective, then the incidence does not change the prevalence. The incidence. So what we are saying is, in case of the new treatment for a disease, so new treatment for a disease is effective. So in this case, the incidence does not change. So the incidence does not change, whereas the prevalence decreases. Whereas the prevalence, if you see, it decreases as the duration of the disease decreases. So because the duration decreases, the prevalence decreases. Next is, if you see, the treatment only prevents, if the treatment only prevents death. So in case where the treatment, it prevents death. It prevents death. So in this case, but does not cure the disease. So it prevents death but no cure. No cure of the disease. So it may cause a paradoxical increase in the prevalence. So in this case, there is a paradoxical increase in case of the prevalence. So this was all about the incidence and the prevalence. To learn and grow daily, please do subscribe.